Well, good afternoon, everyone. I'm assuming most folks are on the East Coast, so good afternoon to you on the East Coast and good morning to everyone else. Brandon Garrett here at the National Minority Equality Forum with our usual Friday webinar. This one seems more urgent, timely, and more important than ever, especially with everything that's going on, not only in our federal courts, but across it, like seems like every state house in the country. And so leading that conversation will be our one and only on protecting women's health will be our one and only Mia Keeys. And so Mia.
Brandon, you hit the nail right on the head. I'm really very much looking forward to this conversation. It's not only timely and critical, but I personally think that this is one of the most significant conversations and potentially decisions of the 21st century with respect to sovereignty, with respect to health care in general, and certainly with respect to civil rights. And here with us today to help bring out and broaden that conversation, we have with us Ms. Jacqueline Ayers of the Planned Parenthood Federation of America. She serves as a Senior Vice President of Policy, Organizing, and Campaigns, where she's responsible for the overall Federation's legislative affairs, strategic direction, where she's also working on global advocacy and federal and state policy in order to expand laws and policies that overall increase access to healthcare, and we're including within that abortion care. She also just has a plethora of background with respect to legislative as a legislative director for the National Urban League in the past. She was in LA, a legislative aide in the House of Representatives in the past, and she's also a graduate of Western Kentucky University and the Indiana University School of Law, where she's also barred to practice. And I'd also be remiss if I didn't mention that she completed the first cohort of the Rockwood Fellowship for Reproductive Health, Rights, and Justice. So Jacqueline, thank you so very much for coming and being with us today. We'll have a lot to ask you. We also have with us the one and only Tammy Boyd, who is with Black Women's Health Imperative. She overall, Tammy, I'm a big Tammy fan, is an established healthcare executive with overall experience and expertise in government relations and political compliance and advocacy, as well as in overall legislative policy strategy. She too has a background in the House of Representatives, having previously served as the legislative director for Congressman John Lewis, may he rest in peace. And overall just has insight with respect to Medicare, Medicaid, graduate medical education, women's health. And when I say women's health, I'm talking the spectrum, everything to do with intersectional issues that bear on women's health, economics, justice issues, and so on and so forth. And Tammy also has her MPH from University School of Public Health, and her JD from the American University. So Jacqueline and Tammy, thank you so very much for being with us today. I'm going to just open it up to you all. We're talking about women's health and specifically the Women's Health Protection Act and some SCOTUS related conversations. What really moved you all to come to this conversation? And what is it that you wish for the audience to take away? And by the way, audience, when you have questions, because I know that you will, please put your questions in the Q&A box below, okay? You'll probably also have some things that you want to say in response to some of our panelists' remarks, but then also in response to each other. Put that in the chat. Put the questions below, put your comments in the chat, okay? I'm not going to see the questions if they're in the chat, but I will see them if they're in the Q&A below. All right, so Jacqueline, what brings you here today?
I just want to say thank you so much to the National Minority Equality Forum. Thank you for your participation today, to all of everyone who's joining us. It is so important that you're here. It is a true crisis moment for abortion access in this country. We have to think about something. I think particularly as Black women who I see on this panel who are speaking today, we haven't lived in a time when we lost our constitutional rights. We don't know what it means to lose our constitutional rights. So this is a moment in time we know we cannot sit silent and be quiet. The fact that this Supreme Court with Trump's majority has decided that it is time for us to lose a constitutional right that has been put forward 50 years, many of us who have always lived with constitutional rights of having the ability to have freedom around our own bodily autonomy, is not a world we know. I talked to my mom, who went to segregated schools in the South, who didn't have the ability to go to schools with white kids until she was a teen, and Brown versus Board had been enacted, who has worked in her lifetime to restore her and my dad restore their one-room schoolhouse and make sure that it is a part of the county's history where I grew up. Listen, we as people know and understand, like we don't just stand idly by and watch our constitutional rights fall by the wayside. The fact of the matter is that if you read the 98 pages that Justice Alito wrote, the draft leaked opinion from last Tuesday demonstrates that they want to take us back to a time that's not just 50 years ago, it's over 100 years ago. He has multiple references to legal scholars who have long been dead from the 17th and 18th century, who did not recognize women's participation in society. It is so imperative in this moment that everybody who has voice, who cares about personal autonomy, not just abortion rights, but contraception, marriage equality, bodily autonomy, your right to privacy. There are so many things embedded in the Alito draft leaked opinion that came out last week that show us, if given full opportunity, this Trump-led Supreme Court will actually put us in a place where we go back, not forward. So that's what brings me here today. That's why I'm so glad that you are focusing on this issue, because we need everybody. And I'll turn it over to Tammy.
Yes, absolutely. I agree. I can't agree with you more, Jacqueline. But yes, also want to first start saying thank you to the National Minority Equality Forum. Also, for those of you who may not know Black Women's Health Imperative, we are a national organization dedicated to through policy, advocacy, research and development, advocating for the 22 million Black women and girls. And as Jacqueline mentioned, I mean, first, just to sort of level set that right now, abortion is still legal in this country, and this is a leaked draft opinion from the justice, from one justice. Despite the Supreme Court leak, abortion still remains legal in all 50 states in the United States. But then, of course, if the court does overturn Roe, there are at least 26 states that could move to severely restrict or ban abortion, including the 13 states with trigger laws that could immediately take effect. I mean, we've all, Georgia, we're now, they're considering the Dobbs case, Mississippi. So that means that half the country, the people would no longer have power over their own bodies and their own lives. And so specifically what brings me here today is that really looking at how this will impact Black women, and Black women and pregnant people really already face barriers to accessing basic healthcare services. And the Supreme Court's rumored decision to really overturn Roe will put our reproductive health, our rights, and safety even in greater danger. It will really declare, open season on women's lives. And so, as Black women, our fight has always been and really continues to be about the human right to control, as Jacqueline really alluded to really control our body, our work, and our community. And so a final decision really from Supreme Court really banning abortion will not really change that part. So, really we're here today to kind of talk about what that impact will be if Roe is overturned, how that will impact Black women and low-income women, and how they may be harmed by Roe's being overturned.
Tammy and Jacqueline, thank you so much for those opening remarks. You both were able to truly articulate that this is not just an issue that is squarely about abortion. We're talking about the health and protection of a woman's body. So we're talking about corporal issues here, corporal as in body, but we're also talking about economic related issues. We're talking about the health of the family. We're talking about the really, like I mentioned before, sovereignty. And I must admit, I just had a baby, Tammy knows this, 5 months ago. And I could not imagine not having the ability to make that choice to have my child, right? And so before we get any further, I want for you two, one of you or both of you, to talk to us about the significance of the law, right? So in this case, I'm not so much talking about the ruling, I'm talking about the Women's Health Protection Act. What is the Women's Health Protection Act? What does it protect against? What does it uphold? And why do we need it? You're muted there.
I will jump in first, and then I'm happy to turn it over to Tammy. I'll just be brief. I think it's important to start with the real world impact of what we've seen happening since back in September. Folks may realize that Texas passed a 6 weeks abortion ban that also allowed your neighbor, any person, as a vigilante, you could go after and sue someone who could be considered aiding and abetting, is what the law said. If you were considered aiding and abetting, you would be able to make a lawsuit against a person up to $10,000, a doctor, a neighbor, the Uber driver, anyone who is helping you get an abortion before 6 weeks. We have stories that are coming out of Texas that tell us why there is need for a national moment, a national law, and why we need to actually be able to enforce upon our elected leaders the need for an answer. Our folks in Texas, the Planned Parenthood health centers in Texas have continued to provide care. Up to 6 weeks of pregnancy, you can get an abortion. You can continue to get family planning services, birth control, STI screenings, cancer screenings, annual well women's visits are still available. The reality is that most people don't know at 6 weeks that they are pregnant. And they have to come in, they get tested. And we've heard stories of people who, because of laws, this didn't just start, I think it's important for people to know, it didn't just start now. Texas has had terrible restrictions on the books for many years. So because of existing Texas law, you have to come in, have an ultrasound, and then wait another 24 to 48 hours to come back. There are people who, since the SB 8 law passed in Texas, show up, get tested, want to get a procedure, but they also test positive for COVID. And now you have to go home and wait for 10 days. They come in and have the approval to get their procedure, but they have to come back in 72 hours because of the existing law. When you come back, now you're no longer exactly 6 weeks, so you're no longer eligible. There have been stories of people who can't get out of the state, who are being forced into pregnancy, stories of people who have showed up, who have a wanted pregnancy, who want to carry to term, but have a complication. They show up at a hospital, an emergency room in Texas, and they are being told, well, you're not sick enough. Go home, wait until you have sepsis. And when you have sepsis, which means you're near death, that come back when you're near death. Then the hospital administrators will let us take care of you. We don't have to wait for this day of like, what is going to happen when Roe falls? Texas is already telling us what happens when our constitutional rights have been denied, because the stories that are coming out of Texas are heartbreaking. So a national solution is needed. That's what the Women's Health Protection Act offers. It takes away the states who have put in place barriers that have been, I think since 2010, 2011, states have been putting in these barriers in place from people being able to get access. And the Women's Health Protection Act is an opportunity to offer a balance of what would it mean? How does a state actually balance the needs of a woman's healthcare versus a state who has put forward these barriers? So we at Planned Parenthood have long been supporters of it since it was first introduced. We're glad to see the Senate vote on it this year. Obviously, we know that there are not 60 votes in the Senate to pass it, but it is a clear marker in the ways in which we know that real people's lives could be impacted if it were to pass. So I'll turn it to Tammy.
Yes, I think you articulated that well. And, even to follow up, as we know this week, the Senate, they tried to, they were unable to pass the legislation really to protect, access to abortion ahead of the Dobbs ruling. And so it also calls into question just generally, like how do we even address that? I mean, so I'll say, one of the things that we're also supporting, to just interject, is even the filibuster, to be able to employ the filibuster, right? To be able to block critical voting that was used to like block critical voting rights legislation. And so addressing that, I mean, so, now it's, we couldn't codify abortion, it did not pass the Senate. We hit a roadblock in terms of voting rights. And so it just calls into question just even a larger picture of like where we are in our country. And sort of how do we address that? Because we know that most Americans support congressional action to guarantee abortion rights, yet they were unable to pass that on earlier this week.
So what do you say to people in terms of what's next? If we're not able to codify Roe, then where do we go from here? Is it we're looking directly at the states?
I can start, Jacqueline, maybe you can. So, I mean, I can say, well, we're doing definitely at Black Women's Health Parents. I mean, first, we're a part in collaboration with Planned Parenthood and other reproductive justice organizations. We're a part of a campaign called Liberate Abortion, and we're working to come up with, different rolling up our sleeves, even going door to door, going to the different states and really amplifying this message. We're also working specifically with the RJ groups and coming up with a strategy in terms of how do we address this specifically in the Black community, and particularly, ahead of our midterm elections. So we understand that, when and if this decision, which it likely will come out, that we're going to have to be prepared to really roll up our sleeves. And I mean, this, sort of deviating here, but I mean, just the strategy of even getting to this place has taken years. And so I think also viewing this not as necessarily a moment in time, but it's going to probably have to be a movement that we are restructuring to address just some of our larger issues in this country, such as making sure we continue to have the right, autonomy to have abortions. It's one.
Yeah, thanks, Tammy. I would just follow up to say that, like, to double down on a point that Tammy just made, we didn't just arrive here. Like, the opposition has been working to roll back access to healthcare, full stop, not just abortion, right? Like, we have been fighting to protect the Affordable Care Act, which has allowed for more people and people of color to get access to no cost contraceptives, and having that birth control that you don't have to pay out of pocket for has meant a ton for nearly 60 million women in this country. We know what it means when you have a health insurance plan through your job, but doesn't cover your abortion care because your state has put a ban in place, or you're a person who is already a mom, but you are not able to care for another child, and you live in a state where Roe hasn't been fully accessed because you have to get time off work, hotel, travel out of state, you have to get childcare. There's so many barriers in the healthcare system for people of color, as there is. What the Supreme Court said to us last Tuesday, even in a draft form, and we're going to wait and see what the actual final decision is. We think that will come in the late June, early July. But what the Supreme Court shows is that they're not going to offer relief. The courts can't save us anymore, right? That's not going to be the place in which we're able to get care. And I think that people need to understand, if our healthcare is not protected, it's going to be our contraception. It's going to be same-sex marriage. It might be affirmative action. It might be voting rights. There's so many rights that are at stake with this court. And so I do think that as a collective, people are going to fight back. Today, that Navigator poll that came out showed that 73% of Americans do not want to see Roe v. Wade overturned. They are paying attention to the draft leak opinion that came out from the Supreme Court last week, and Alito's words. People do not want to see this be the order. And so I think that means is that we are going to have an active electorate of people who are going to show up, fight and support their rights, and ultimately, not this election, maybe not the next election or the next election, we're going to see that people are going to demand to be written back into the Constitution. I think that women, and particularly Black women who have voted consistently for their rights are not going to sit by and see the rights eroded in a way that they don't also then, as a next step, start to call for a constitution that represents them.
And just to kind of even, as we talk about like the impact on Black women and how they will be harmed if this is overturned. I mean, so just to say, for example, Black women currently receive 38% of the abortions nationwide, so they will definitely be disproportionately harmed. If this is, restricted in, Roe is overturned or is restricted in their state. And then also, if you look at, for example, the places in the South that have the most hostile to abortion rights are really where you tend to have disproportionately a large population of Black women. And then also, if you talk about what the impact is, many times Black women tend to have less disposable income on average than their whiter counterparts. So even paying to travel to another state to get an abortion might not be as possible. We've all, as we look at even just larger, the Black maternal health crisis, I mean, we're addressing that, but the Black maternal mortality rate may go up by restricting access to abortion. Means that more Black women will have to carry unwanted pregnancies to term, which can even pose greater health risks than planned pregnancies. Also, Black women, there's a criminalization component. They will be targeted, policed, and harassed for violating their abortion restrictions. So I think, we can keep going. There's the mental health aspect and the physical health aspects. I think there are just numerous ways that Black women will really be disproportionately impacted if Roe is overturned.
Tammy, I actually think we have room to enumerate what those other issues are if between you and Jacqueline. Let's take some time to really lay that out. We have the time to do that.
Yeah. Jacqueline, I don't know if you want to go, if you want me to.
Go ahead. Yeah, sorry.
Oh, okay. So I would say, another aspect would be, Black women would tend to develop more mental and physical health issues that stem from being denied wanted abortions, really at a higher rate than their white counterparts. Also, we can look at the economic impact. Black women will suffer economically. Being denied a wanted abortion increases really your odds of a woman being below the federal poverty level by 400%. And then, we're also saying, these are just things that the impact is just a lot, a lot broader. We'll also, lose potentially educational and professional opportunities. And so the decision, it will really negatively, impact lives of young Black girls who are victims of incest, rape, and sex trafficking, and who are too young to parent. So also, as we mentioned, just overturning will take away really the bodily autonomy of Black women. And, working closely and as a reproductive justice organization, we really look at just the entire picture of how Black women are impacted, just not the right to not have an abortion as well, but also the access to healthcare services.
I totally agree. And thank you, Tammy, for raising all of those concerns. I think that too little attention is paid to the impact on women, and particularly women of color, of what banning abortion is. And Tammy just laid out all of those issues. We saw this week the Secretary of Treasury, Janet Yellen, named abortion bans are an economic issue. Right. And so this idea that somehow it's a social issue, it's political, it's something that's controversial. It's not true. We know that for people's lived lives and experiences, it's an economic issue if you are not able to choose to parent and raise another child, to have childcare, to have time and paid leave, to have healthcare, to have food, housing, security. Tammy just laid out all of the reasons how having to be forced into parenting when you're not ready could have generational concerns, right? Not just one generation. It's not just that one mom who has those concerns. If you do have mental health, economic, housing, educational battles, that is going to impact generations of Black communities. And we understand, right, from past trauma and harm and other things that have happened to our communities, we don't need another reason to introduce more tragic harms to our community. So I do think it's important to note, if people, I frequently hear this, if people say, well, you know, it sounds really bad and maybe it's not my issue. I don't work on that. It's not my healthcare area. It's not my focus. It's not something that I have to think about. And I will say to people, the fact that 1 in 4 women in this country have had an abortion, you know someone, you love someone who has had an abortion. It is a part of people's ability to move through their life, to plan their educational and economic and job experiences, to build the families and circumstances they want to have. And so, again, it's not just going to be isolated to a few people. It's not a issue that only is going to impact Black women, but I think Tammy laid out well for us why we should be paying attention, because people of color are undoubtedly going to be harmed most by these bans. I think at the core of why abortion bans are allowed to pass in some of these hostile states is white supremacy, right? Because we do know that if you're forcing someone into pregnancy and a family that they're not prepared and not ready to parent, they are going to live at the lowest levels of the economy, have less housing, less job opportunities, less educational opportunities. So we have to unpack the idea that an abortion ban is just focused on a few. It's really focused on our communities. And I think it's really important more and more. And I'm so grateful the National Minority Quality Forum is focusing on this, because the health impacts of an abortion ban reach far beyond just the communities who are most vocal about it.
And given what you've both said, because this is an economic issue, and because we can focus on the intersectional issue of abortion, so not just economics, but abortion care is healthcare. I think we can really pivot and talk about that. But I do want to get back to something you both said. You know, Tammy, you talked about this being a movement and not a moment, and Jacqueline, you talked about how the attack on rolling back rights in general, constitutional rights, and especially the strides that we've made with respect to our healthcare, that dates back to, you know, before the Affordable Care Act was actually codified into law. So I do want to talk about that a little bit, but I also want to point out, you know, just to make this even more vivid, there are over 50 people that are on this webinar right now. You know, you're talking about 1 in 4 women have had an abortion here in the US. We can really look at this list of people who are on here, and I promise you, every single one of us has known someone who's either had an abortion, we've been that person who's had an abortion, our partners have had an abortion. So I'm very, very clear and wanting to be very clear that this certainly does impact all of us. So I actually jumped around there in terms of the remarks I wanted to make, but I want to talk about the movement versus the moment situation and what this means in terms of where do we go in bolstering our healthcare. And then I want to talk about what allies and accomplices and persons who are not birthing people can do to uplift this conversation, and why everybody needs to be attentive to it. So first, movement versus moment, and then allyship and accomplices.
Well, I would just say thank you to everybody whose time and attention is on this call today. You can show up tomorrow. Saturday is a National Day of Action on May 14th. We're asking people to look at the website, bansoff.org. That website, you can type in your zip code and find an action near you. We had been planning this even before the draft opinion, because we wanted to make sure that people were paying attention, knew what was happening, wanted to draw attention. We're asking people to show up at local rallies, hear from speakers. Some people are not doing a rally, but they're doing a phone bank. Virtual opportunities also exist. So thank you for the folks asking. I will put in the chat. And
already Keiko took care of it.
Thank you. We will make sure that you guys have that, because we do want people to show up, right? I do think it matters a lot that literal boots on the ground, people in the street are how our elected officials are going to know that this is an important issue headed into the 2022 midterm elections. It's also how at all levels of government, people are going to be paying attention and thinking about what are the solutions. All hope is not lost. I will say that we have seen some blue states who are starting to think about policy solutions, thinking about ways that you can do things like expanding the practitioners who can provide abortions, not just doctors, but making sure nurse practitioners and other senior staff are able to provide abortions. We've seen that in Maryland and Connecticut, making sure that there have been states who have been funding abortion funds. Abortion funds are key to helping those folks we talked about who need financial support to cover travel or time off or childcare or hotel rooms as they leave states like Texas, and supporting abortion funds, supporting independent clinics, supporting those who are building the movement have been a key part of what Planned Parenthood has been focused on these last few months. I would just say, before turning over to Tammy, I think this is an ask to join in the long term. This fight is not over. The Supreme Court cannot have the final word. Trump Supreme Court cannot have the final word. We are going to need a broader understanding of the Constitution, states who are standing up and who are maybe thinking about a long-term constitutional amendment that gets us back in. If Alito's opinion is allowed to stand that says that the Constitution does not speak to this issue, then the voices, the people, the boots on the ground are the ones who are going to be needed to help this Constitution finally and ultimately speak to the need for our bodily autonomy. So I would say that's where we're going. We are a long way off, but showing up on Saturday is the first start in that long arc to getting our rights back into the Constitution.
Rain or shine.
Yeah.
And so I definitely agree that, May 14th, and you talk about, sort of meeting the movement, or this is the movement and not necessarily a moment. And so there are probably two examples. I mean, so for example, we just earlier alluded to the Liberate Abortion campaign, which is really a multi-tactical coalition of more than 150 organizations, which are really coming together to expand the power, really grow compassion, provide education, and build sort of a groundswell of support for abortion access across the United States. And so as Jacqueline mentioned, we've been working on this even before the leaked opinion, but we have 5 strategy tables. There's a narrative and cultural change. Who's responsible for communications and strategies and tactics in our communities. Mobilization and organizing table. The federal outreach, which Black Women's Health Imperative is one of the co-chairs of that group, which is really our outreach and Hill engagement around this issue. We're also doing scenario planning. What we thought, in cases would come down in June 10th or later in June, the final opinion. And then even looking at, sort of electoral strategy. And so we really tried to build collaboratively with women of color, Black-led organizations, along with other organizations such as Planned Parenthood, Center for Reproductive Rights, and really coming together collectively, the entire ecosystem, to really look at how do we make sure that we create a movement for bodily autonomy and abortion access. But then specifically, again, in the Black women area, the reproductive justice, they been working on this for years. The reproductive justice movement. And so Black Women's Health Imperative, in collaboration with In Our Own Voice, Sister Love, Spark, Sister Song, who many of you may know of these groups. I mean, they're rolling their sleeves and doing a lot of the hard work as well, and really concentrating and mobilizing on the state level, working in collaboration, filing amicus briefs, and getting out and holding round tables. And as Jacqueline mentioned, showing up to rallies locally on May 14th. And so I think it's really this type of collaboration and sort of building everyone, grassroots, the federal, bringing all pieces together to really push a movement and a campaign so that we can, really address this. And again, I think it's going to take, it's not going to be something that just happens in June or July. We're going to have to, for example, get out to vote during midterm elections to make sure each of those areas, the local, the statewide and the federal, and who your president is, all of that, in terms of appointing your Supreme Court justices, to who's your governor, your state legislatures, Republican versus Democrat, like or people who are aligned with whatever issue is. We're going to have to really go from all cylinders to really address the fundamental, right to abortion access.
Can I just add one thing that Tammy just reminded me of, and I'm so appreciative of what you just said. I do think it's important if we can talk about 2022 elections on here. There are
out of my mouth. I was hoping you would.
Good. There are a few states. I think it's important just to note that, and Tammy just said that. I just want to name the states. The difference between winning a governor's race in the states of Michigan and Wisconsin literally relate to whether or not people will have their bodily autonomy. If we do not re-elect Democratic Governor Gretchen Whitmer in Michigan, that's a great example. That's a state that has a pre-Roe abortion ban. I think their ban is from like 1930. They put it on the books a long time ago in the 1930s. It's a law that says if Roe v. Wade, if abortion becomes illegal at the national level, Michigan will automatically make abortion illegal with no exceptions, no timeline. The difference between winning a governor's race is healthcare. Like actual healthcare access is if we reelect Governor Whitmer in Michigan. Same thing for Tony Evers in Wisconsin. And so I do think it's important for folks to note that it's not just like a midterm election like we have previously seen. And I know everybody has seen these pontificators and the folks who tell us about midterms. If you're an incumbent party, the idea is that you lose. Right? That if the incumbent is in office, there's a midterm, the incumbent loses, the other party wins because people like change. That's what pollsters always tell us. I think this year is going to be different. It has to be different. We have never, again, I said this earlier, we've never lost a constitutional right before. And I think people are going to be paying attention to that. And they understand they're not going to sit by and lose a constitutional right and a constitutional access. And the difference in governors and state legislators. North Carolina is a great example where if we do not continue to hold the veto-proof majority in that state, the governor cannot continue to protect rights by vetoing bad bills and legislation. So if the Supreme Court is really going to issue an opinion that returns everything to the states, that means that we've got to pay attention, wake up, follow state elections in maybe a way that we have not previously. And I do think, again, someone put in the chat, the Navigator poll showing 73% of people are paying attention, the issue is breaking through. I think that's going to have a big impact on the midterm elections because people understand it's not just about who you vote for, it's truly going to be about healthcare access.
Tammy, you worked literally, and I very much appreciate what you just laid out there, Jacqueline. Tammy, you literally worked for the, really the epitome of pushing for rights and his entire life, his entire adult life, and certainly as a youth, and I'm speaking specifically of the Honorable John Lewis. And you said earlier that this conversation is very much more than just the conversation around abortion specifically. And Jacqueline also just mentioned this. This is a voting conversation. I have to, because I'm chief of staff to member of Congress, I'm going to tread lightly here, but I do want you to please help us to bring that conversation a bit more, Tammy, you know, you come from a tradition, an office that traditionally has been very practiced in pushing for rights and for civil rights. There are offices, whether it be on the liberal side or on the Republican side, that does not have such a practice, right? There are people who politically don't have such a practice. So how do you communicate the significance of this movement to those people, especially if they might want to be accomplices, but politically the practice does not align with what they're used to?
Yeah, and I think, I can take a crack at that. I mean, so, you know, definitely working for Congressman Lewis, definitely an honor, and, you know, just having the opportunity to just observe and hear many of, you know, the stories and the civil rights movement. And what you'll see, I think there are a lot of, you know, examples that we can take from the civil rights movement, because they, you know, did, you know, really succeed in sort of changing and making sure laws were passed. And from that, for example, you know, it wasn't like a one person movement. I mean, they brought together, you know, Black, white, Jewish, everyone together sort of had different parts of the movement. But they all aligned that, you know, we need the right to vote, or we, you know, the rights that we, fundamental rights for African Americans. And so I would say, you know, much of what we're doing, it's really a lot patterned after what they did, you know. So for example, with the liberated abortion piece, you know, we're putting together a caravan, and the caravan, you know, is going to be stopping in different states, such as Texas, Louisiana, and they're having rallies in Jackson, Mississippi. You know, also just really figuring out, it's a very strategic. It wasn't sort of something you just sort of shot from the hip. They had meetings, they met constantly and talked about what is the strategy and how do we achieve, you know, this right. And so, you know, and maybe at the time, I think at the time, they definitely knew that it was important what they were doing. I think even currently we know how important it is, but what we're doing now is really, you know, as Jacqueline said, I mean, a lot of folks have not lived in, you know, where abortion was not a right. And so we're fighting for the abortion piece, the vote, continue to try to keep the voting rights piece here. And so it is we're creating something that will have have implications for generations to come. And so it really is a very, you know, the strategy, the thought, in the resources and things that you need everyone to sort of make this happen and to move it forward. And so, you know, I always say, definitely looking back at some of the I don't want to call it the playbook, but the strategy that they used during the civil rights movement. I mean, it's very key, and that's really what we're trying to implement now. And so, really examining some of those tactics and those strategies could really be lessons for this current movement and other movements for folks who want to continue, who do not want their voting rights restricted, or who want to have access to abortion. So looking really at some of those critical lessons and how that was achieved.
I think that was spot on. I mean, when we're talking about, so Jacqueline, you were talking about the Patient Protection Affordable Care Act before, but milestone legislation in terms of health before that is Medicare and Medicaid. A lot of people don't think about the fact that Medicare and Medicaid is the premier health insurance source in our nation, right? But a lot of people don't think about the fact that it was voted into law around the same time that voting rights were also given. And that was a direct impact and effect of our civil rights leaders in the 1960s and prior, right? Jacqueline, I'm so glad, Tammy, you mentioned that as the playbook, because it is absolutely. And our leaders, who we esteem, worked with people all across the political spectrum and had to, because people in power were not always aligned with their views politically. Jacqueline, the irony of a lot of what's going on at the state level is that Planned Parenthood got its a lot, and correct me if I'm wrong, a great deal of its origins were in the US South, and specifically in Texas, right? So you all have an historical presence and practice in going against the grain in terms of fighting for abortion care and largely healthcare in spaces that are contentious and continue to be contentious with respect to the health of women in particular, right? So can you speak to that a bit? And Tammy was just talking about strategy. Can you talk to that strategy a bit?
Yeah, absolutely. I think let's just put it on the table. There's a lot of history of Planned Parenthood. People understand it as being a white women-led organization and white women-led movement. Planned Parenthood, I should say, is currently led by a Black woman. Alexis McGill Johnson proudly serves as the president after a decade of being a member of the board. So she's the second Black woman. So I give a lot of credit to anyone who hasn't read the book of Faye Waddleton. I recommend it frequently. Faye Waddleton led the organization at the end of the 70s through the 80s. She's a nurse, and a big part of the reason why all Planned Parenthoods today provide abortion, because she understood that to be free, the messages that Tammy just talked about that our reproductive justice partners hold true is that in order to be able to make decisions about your life, your choices, you needed to be able to access the ability to have autonomy over your body, and that includes abortion, whether or when to parent. And so I do credit a lot of the history of Black women, but it is something we have never walked away from. We are clear-eyed about the fact that the organization's 106 years ago history has been founded by the founder. Margaret Sanger is someone who did believe in eugenics and who did not uphold racial justice issues and qualities and principles that we hold today. Our current president, Alexis McGill Johnson, wrote a New York Times article about this piece, and she wrote that piece because she wanted to denounce the history of the organization, because while there is a certain small period of time that is our founding, there is over 100 years of providing healthcare and access to people who are low income and people who look like the folks on this call. And as when I stepped into the role of legislative director over a decade ago, when I asked at the time, mostly white legislative team, I said, you will not go to Capitol Hill and talk to legislators about the work that Planned Parenthood does unless you spend a day sitting inside of the waiting room. I need you to sit there and see what it looks like and feels like for a patient who has to get their health care at a Planned Parenthood. And when you go to the outside of DC, we went to the Baltimore Health Center downtown, and guess what? Their faces look like mine. Those are the patients who need care, and I make sure that our staff understand that is the message and the voice and the patients who you're taking to Capitol Hill. That is really important to the people who run Planned Parenthood today. And we do not denounce or walk away from the history. We acknowledge and also recognize that there's been a lot of work done since to strengthen our relationships with reproductive justice providers, with abortion funds, with groups who are leading in the space, as Tammy said, by people of color. And particularly women of color and Black and brown women who are leading in this moment to support this moment in time when we're facing abortion access being completely decimated in this country. It's so important. We're all doing everything we can to understand who are those folks who are standing in the gap. And predominantly that is women of color. Women of color are helping people get care, unfortunately right now, what it means is getting people to the care because the care is no longer in their state. And that's what abortion funds are doing right now, is getting people to the care. They're helping people get out of Texas to get to New Mexico. They're helping people get to Oklahoma. If you guys watch The Daily, listen to The Daily podcast, is a great piece on this about a Black woman who's just trying to get out of Texas, get her childcare. Her partner is trying to figure out what to do about loss of work because they cannot afford to parent a second child. These are real life stories, people who we know, people who are like the folks we know in our family. It's so important right now to center the voices of people of color in this fight, in this moment. And I do think that unfortunately, you know, if the Supreme Court's decision becomes final, we do anticipate that the decision will come down end of June or early July. And when that decision comes down, those are the voices that all of our organizations should be lifting up, is paying attention to the real harm that's happening in states. And it won't just be Texas anymore. Unfortunately, it's going to be many states who are having those experiences. And we need to make sure that people are hearing those stories, telling what's happening so that we can bear witness at the ballot box in November.
I wish Zoom had one of those reaction buttons that you snap. Zoom needs to get on that. We need to, NMQF, you need to get with your Zoom partners and let them know that's what we need for everybody who comes through and graces our audience with your wisdom. So we're coming to a close, but I want to acknowledge that we do have people who are, by the way, if you do have questions, you still have time to submit them and I can uplift them. I'm going to also check my social media to see if there were any questions that came through when I posted about this. But we have a number of people who regularly tune into the NMQF Friday webinars, and a lot of them represent industry. They don't necessarily come from the nonprofit world. They're not necessarily academicians. But so what would you say specifically to the role of industry in terms of engaging the conversation of the moment? And then also in terms of engaging its employees to consider the movement. Now, I say that also acknowledging that a lot of corporations, very much stray away from these level conversations from time to time, not even just from time to time, in a large way. So in your opinion, or even in your practice working with different organizations, what is the role of different industry?
And Jacqueline, you may be able to speak to this. I don't want to. I know that since the leaks draft, there have been several companies that have sort of come forward to help with, for example, providing abortion funds, or I know there's some folks who may be helping even for the transportation aspect as well. But I would say it's really I wouldn't just look at it also as just look at it for two ways. For corporations or companies, organizations, look at it as it's the entire picture. So for example, when you talk about even and I'm going to be going on a tangent here, but even when you talk about the lack of banning the access to abortion, it's sort of it's the same person. This will disproportionately impact women of color, but it's the same person. For example, when you talk about why is there difficulty getting them into a clinical trial, or why is there difficulty, getting them to participate or be compliant? Because it's the lived experience of the entire person of color, the woman of color, person of color. And so I would say even, looking at it from that standpoint as well. But then also, the movement needs everyone. It's not about Black women, white women, or a certain demographic of women. It's really about everyone coming together collectively, because, I'm sure you've heard, this may have implications for other decisions. We may get into, whether now we're going to, turn back interracial marriages or, LGBTQ rights. And so now we do not want to be a slippery slope, and we begin to dismantle really our democracy in our country as we know it now. So I would say, that is why companies and organizations really get involved, because I think we're really trying to protect our fundamental rights and democracy. I think that all of us will, want to enjoy for ourselves and for our children and our grandchildren.
I totally agree, Tammy. Thank you for saying that. I would just reiterate what Secretary of Treasury Yellen said yesterday, which is that an abortion ban is an economic issue. Companies need to care about this because employees don't want to go to states that are going to ban their rights. And I don't want to take a high-powered job somewhere or go to a college in a place where I don't know if I can get access to all the health care that I need because a state doesn't practice my constitutional rights. We have seen some states step up and say things like they would pay for people to travel, or they would pay for paid time off. I would say you need to pay for paid time off for an abortion and paid time off for parental leave as well. We need all the things from corporations right now. You know, we have seen a tremendous response today in the New York Times. 160 celebrities put forward an ad saying that they denounce the intentions of the Supreme Court to overturn Roe v. Wade. So we need celebrities and corporations and everyone who is working to hopefully break through, grab attention when we see the folks that we follow, companies that we support, standing up. It matters a ton. We at Planned Parenthood are also asking not just corporations, we're asking the White House to move forward and convene corporations, and making sure that the highest levels of government are engaged and using their bully pulpit to inform corporations and all constituencies about the need to denounce the actions. And the last thing I would say is it's really important that corporations consider their political giving. And if you're supporting the state legislators who are passing these bans, it's time to look again at who you're supporting electorally. Many corporations supported the legislators in Texas who passed voting rights restrictions. They're the same legislators who also passed Texas a 6-week ban. So the political giving is the other area that I think it's time to put more attention on, where corporations are focusing their resources.
You're both speaking such truth here. The one thing that I will add is, in the season of COVID, you have a number of corporations that were really very quick to make pledges for diversity, equity, and inclusion. And if this isn't, putting your money where your mouth is, then I don't know what would be, right? So I'll just say that. So I'm going to issue you all a final question, and then I'll ask for last remarks from you. When we look back at the playbook, as Tammy mentioned, and the players who preceded us in terms of really marching forward, whether literally or figuratively, for rights of everyone in the nation, there were just different elements that they had at their disposal. Certainly social media was not one of them, but we do, right? And we can imagine that what we say will live in infamy, because YouTube is a forever living thing, and there'll be other platforms that come and go as we age. But 30 years from now, or 50 years from now, there will be someone who might watch this video, or someone who follows you on Twitter, or someone who joins either organization. What is it that you want to say to them in terms of this moment, in terms of this movement, and in terms of the work that they probably, hopefully, will not have to do, but if they do have to do it, what can you say to them?
I want to say, I guess I'm so proud for you not giving up, because I don't know in 30 years if we're going to be written back into the Constitution, but I hope that's the work that you did, was making it really clear that our rights are recognized and solidified in the Constitution that Trump Supreme Court sought to eradicate us from. And I would just say a thank you.
Yes, and I'll echo that. I would say, definitely don't give up, and really try to, understand it's bigger than the one person and yourself, and that you're fighting for something larger than yourself that really is a part of just a big picture of really moving that needle on history. And so, have that faith, or whatever that thing that makes you just keep going, and do not, the task may be seem daunting, but, as Jacqueline said, don't give up, or as John Lewis says, keep the faith.
Jacqueline Ayers, Tammy Boyd, final words from either of you?
I would just say join us at a rally or join us online at bandsoff.org. And thank you for the National Minority Equality Forum for this presentation.
Thank you. And vote. Yes.
Jacqueline Ayers of the Planned Parenthood Federation of America and Tammy Boyd of Black Women's Health Imperative. Thank you so very much for joining us today. I'm Mia Keeys, Chief of Staff to Congresswoman Robin Kelly, and I'd be remiss if I didn't mention that as a new mama and someone who made that choice to have my baby, this is the conversation that I'm most proud of in terms of having today, this week, and also with respect to what's moving legislatively and how this all impacts mothers, babies, families, and the nation and the future of this world. So thank you very much, audience, for tuning in. And I'm going to turn it over to COO of National Minority Equality Forum, Brandon Garrett.
Oh, no. Well, thank you guys so much for Mia for leading such a great conversation, and Jacqueline and Tammy for, like, just as usual, providing the details that we needed to hear and the sort of anecdotal examples around Texas and other states that really sort of prove the point that this is, it's a, I don't know how slow grind, but it's just kind of been happening and it's been etching up till this point. So looking forward to working with you all and making sure that folks get involved. No real announcement except that I'll see you guys next week when we'll have another conversation. So have a good weekend, everyone. And here in a city that can go to the rally, go to it, check it out. All right, have a good one.